What is MOG-antibody disease? It's linked to NMO and MS. Imagine your immune system mistakenly attacking your own nervous system, causing inflammation and damage. That's what happens in MOG-antibody disease, or MOGAD, a rare autoimmune disorder affecting the brain and spinal cord. In MOGAD, the immune system produces antibodies against myelin oligodendrocyte glycoprotein, a protein on the surface of myelin. Myelin is the protective covering that insulates nerve fibers in the central nervous system, which includes the brain, spinal cord, and optic nerves. When these antibodies attack myelin, it causes inflammation and demyelination, leading to various neurological symptoms. People with MOGAD often experience optic neuritis, which is inflammation of the optic nerve. This can cause blurred vision, eye pain, and sometimes loss of color vision. They may also have transverse myelitis, an inflammation of the spinal cord that results in weakness, sensory disturbances, and bladder or bowel problems. In children, MOGAD can sometimes cause acute disseminated encephalomyelitis, or ADEM, which involves widespread brain inflammation. Symptoms of ADEM include confusion, seizures, and even coma in severe cases. Diagnosis typically involves blood tests to detect MOG antibodies, along with MRI scans to look for areas of inflammation in the brain and spinal cord. Sometimes a lumbar puncture is performed to analyze cerebrospinal fluid. Now, how does MOGAD relate to other conditions like neuromyelitis optica and multiple sclerosis? Neuromyelitis optica, often called NMO or NMO spectrum disorder, is another autoimmune disease that damages the optic nerves and spinal cord. Most cases of NMO are associated with antibodies against aquaporin 4, a water channel protein in the central nervous system. However, some patients who have symptoms similar to NMO test negative for aquaporin for antibodies but positive for MOG antibodies. These cases are now recognized as MOG-antibody-associated disorder, or MOGAD, which is considered a distinct disease from classic NMO. Although both involve inflammation of the optic nerves and spinal cord, their underlying immune mechanisms differ. Multiple sclerosis is another autoimmune disease that causes demyelination in the central nervous system. But, unlike MOGAD, MS involves a different immune response and does not typically feature MOG antibodies. MS tends to have a more unpredictable course with relapses and remissions, and MRI findings often show lesions in specific areas of the brain and spinal cord. While both MS and MOGAD involve damage to myelin, the presence of MOG antibodies helps doctors distinguish between the two. This distinction is important because treatment approaches and prognosis can vary significantly. Understanding MOG-antibody disease from the perspective of multiple sclerosis helps clarify that not all demyelinating conditions are the same. While they may look similar on some tests or symptoms, their underlying causes are different. MOGAD is a separate autoimmune disorder that requires specific testing for MOG antibodies. Recognizing these differences ensures patients receive the most appropriate treatment and management. It also highlights the importance of precise diagnosis, as misclassification could lead to less effective therapies. In summary, MOG-antibody disease is an autoimmune condition where the immune system targets the myelin protein called myelin oligodendrocyte glycoprotein. It causes inflammation in the optic nerves, spinal cord, and brain, leading to vision problems, weakness, and other neurological issues. It shares some features with neuromyelitis optica but is distinct because it involves different antibodies. It also differs from multiple sclerosis, which has a different immune mechanism and MRI pattern. Accurate diagnosis through antibody testing and imaging is key to guiding effective treatment. Always consult healthcare professionals for personalized advice, as each person's experience with these conditions can vary.